Our group of Madeline Mosier, Sarah Moore, Lauren Tibbetts, Jackie Shadone, Brianna Myers, and Olivia Yance chose to do our presentation for you today on the effects of substance abuse. We chose to do this because there have been recent incidences at Oak Hill, including people on sports teams that have been involved with drug use and been suspended for many games, and we wanted to know more about the topic, and that is why we chose it.
On a more personal note, I wanted to choose the topic of substance abuse because my brother went through drug abuse when I was younger. He had to go through many different treatments, and he had effects like personality change and all that kind of stuff. But thankfully, through his rehab, he's now at a healthy state.
Over my article was over drug use during pregnancy. Was the main point was that mothers were in denial and it directly affected the children. Children were born with more defects when their mother did not let the hospital know that they were on drugs. And the mothers also have a high chance of a defect because of the denial. And underreporting through survey directly affected this information. The drug abuse screening test was the most efficient way to tell whether a mother was using a drug or not. This involved hair and urine samples and also the questionnaire. In this specific experiment, 24% of the 300 women were tested positive for drug use, but a very low number actually admitted to doing drugs. Because of some use of alcohol, the results may be skewed, possibly. There was a slight concern with the participants because there was 300 low-income, mostly African-American participants, and 251 were single and 96 neither graduated or got their GED. The children who had a mother who was addicted to drugs had to go through withdrawals, and they used morphine.
My article was titled, "What Do We Know About Drug-Endangered Children When They Are First Placed into Care?" It talked about how the kids coming out of homes where their parents used drugs were affected. It took place in Spokane County, Washington, where they had been experiencing a crazy rise in the number of meth labs like the United States has been experiencing over the past 10 or so years. This study involved 399 children total, taken from homes affected by drugs. The purpose of the study was to find the needs that those kids had as they were coming out of those homes. Most of them focused on meth labs, but there were others included as well. But some of the serious effects of meth on the user, which in this case would be the parents, were brain damage, weight loss, anxiety, and violent behavior. These effects obviously hurt the parent and the user, but they also affect the child because the parent is a lot more likely to abuse and neglect their children when they're on drugs. Usually the kids coming out of those situations feel helpless and out of control. They can't control whether their parents are doing drugs, and they're not in a position where they can change their situation. As the kids were taken into care by CPS, they administered tests to kind of analyze where they were at. They showed slow development in communication, personal and social skills, fine motor skills, and problem solving. They also administered the TSCYC test, which analyzes different types of stress in those kids. It indicated that the group of 40 kids of the total that they analyzed using this test had clinically significant problems, and they were a highly traumatized group. The normal score on this test is anywhere from 40 to 60 points, and the average score of the kids coming from drug homes was 73.79. Although it focused on meth, there were other drugs involved in this study as well, but the author found that there was really no significant difference between whether a parent used meth or another type of drug. It affected the children and how they treated their children in similar ways. The main concerns of this article and the author was the lasting effects of parental drug abuse on kids. It slows their developmental skills and it affects them in vital areas for the rest of their life. CPS is really lacking in medical information about the kids that are coming from drug homes just because either their parents didn't keep up with immunizations or take them to the doctor, or they just didn't keep any record of it, so they don't know where those kids are at coming in.
My article focused on the relationship between anxiety and substance use and anxiety sensitivity as a moderator. It was hypothesized that anxiety sensitivity would be a moderator between anxiety and substance use, and individuals with higher AS would be more frequent with substance use. Anxiety sensitivity, or AS, refers to the fear of behaviors associated with the experience of anxiety. In substance abuse relating to anxiety disorders, research has found that anxiety disorders can increase the use in substances among teens. Studies have also found that increased AS is associated with greater levels of anxiety in substance users. College students are a common example for an individual with high AS. This is because of the anxiety-provoking environment that they are in, and also because of the increased opportunities of substance abuse for anxiety coping. The study consisted of undergraduate students from Northeastern University that were between the ages of 18 and 22. Every participant took 2 online assessments in order to determine the results. Substance use was to be rated on a 6-point scale, answering how many times per week it was used. 40 participants had missing data and therefore were excluded from the analysis. It was determined that anxiety and substance use was significantly associated with the AS total score. It also revealed that there was a positive relationship between anxiety and substance use in high AS individuals. The findings also suggested that young adults with high anxiety may use substances for physiological or cognitive discontrol that are believed to be catastrophic. Age was a positive association with substance use, and males were reported to have more substance use than females. There was a positive relation between AS and sedative, cocaine, cannabis, heroin, and alcohol use. The study suggests to increase the utilization of prevention treatments. In the end, the hypothesis that was tested was correct. AS is a moderator between anxiety and substance use, and individuals with higher AS are more frequent with substance use.
The article by Christina Alleman titled 4 Problems with Psychodynamic Assessment of Drug Abusers addresses how a person's personality is affected by a drug user of any kind, and a personality disorder is also known as a PD, and this research was based off of Freud's topographical model. In the article, Alleman agrees and disagrees with the findings. She disagrees with the way people are tested for their personality disorders, and it does not think that the time span before giving the assessment is long enough to actually measure a person's change in personality. Alleman's first point in the article states that the amount of detoxification time before giving the assessment is not long enough to provide accurate testing results. They should have a 4 to 6 week time span before giving the test, because in that amount of time, drug abusers often return to their desired drug. Her second point was that the abuser actually has to accept the clinical care. Most abusers do not want to hear the responses from the people, and they often refuse to have the treatment. Alleman's third point is that drug interferes with personality, but the questions asked were, how can you measure a person's personality, and how can you determine the difference in personality before using the drug and after using the drug? After using a drug so long, the abuser becomes dependent on the drug and no longer can distinguish their 2 different personalities. Personality disorders with the combination of drug usage confuses the patient in knowing their genuine personality. Lastly, the drug abusers suffer with memory problems, psychological reflections, and lack of verbal communications. Drug abusers are very bad at dealing with critical life situations, and they often cannot distinguish sounds that have occurred in those accidents. Many interviewers look to drawings to help describe the incidences at hand.
My article was written by Glenn D. Walters, who hypothesized that criminal thinking correlated with substance abuse because offenders frequently show higher rates of substance abuse than the normal population. To test his hypothesis, a study was done in 2012 involving 2,877 male prisoners
in federal correctional facilities in the northeastern United States. The average age of the inmates was 35, and their average sentence was 101 months. 2/3 of the participants were serving time for drugs, robbery, and firearms. 17.3% of the participants were white, 63.6% were black, 17.6% were Hispanic, and 1.4% were Asian. The test used in the study was called the Psychological Inventory of Criminal Thinking Styles, otherwise known as PICS. It was an 80-question report that measured 8 different thinking styles, which were mollification, cutoff, entitlement, power, orientation, sentimentality, super-optimism, cognitive indulgence, and discontinuity. It was scored by using a 4-point scale of strongly agree, disagree, or uncertain. The overall score of the test determines if proactive, reactive, or general criminal thinking correlates with substance abuse. The difference between proactive and reactive thinking is that proactive is more intricately thought out and planned and cold-blooded, whereas reactive is more unplanned and unorganized and spontaneous, and it goes on the basis of impulsive decisions. The results of the study showed that that reactive thinking matched with a history of substance abuse, whereas proactive thinking did not. Substance abuse enhances impulses because of the negative effect the drugs have on cognitive functions in your brain, such as decision-making, processing, and behavior. To show how much of an effect substance abuse has on reactive thinking, in 2010, data was collected from tests that were collected 48 hours after arrests and showed a 60% rate for positive drug tests in 9 out of 10 jails. In conclusion, Walters viewed the results of the correlation between criminal thinking and substance abuse to be very scary. He suggested doing interventions with inmates of prior substance abuse. With the intervention, they would use skills training and anger management to help lower the rate of relapse and violence.
Fortunately, 50% of patients going through substance abuse treatment go through relapse within 6 months of their treatment. This article examines patients by using EMA testing, which stands for Ecological Momentary Assessment. The study takes a sample of 100 men and women who are dealing with substance abuse with other drugs such as heroin, cocaine, ecstasy, and many more. The test focuses on distal and proximal processes. Distal processes deals with the environment that a patient is going through, while proximal deals with withdrawal and different cravings and effects from going through their treatment. Each patient was given a personal assessment before they took the test that has to deal with their stress levels, their social situations, their coping styles, and their family history. Some of the participants took the test on a handheld computer device, while the others took it with pencil and paper. This had to do with the EMA testing format. After the participants took the testing, they had to have a 2 and 4 month follow-up to see if they were dealing with any kind of relapse symptoms. The study then found that EMA testing had no effect on the results, and it didn't matter what type of testing they used on these patients. The study also showed that patients dealing with an increase of craving were 14 times more likely to deal with relapse during their treatment. Also, individuals that used distraction as a coping method were more likely to go through relapse than those who dealt with acceptance as their coping method. Overall, this study showed that the type of testing used on patients doesn't matter with the outcome, and also it showed that many patients who go through this kind of substance abuse treatment deal with relapse, but that's in no way it should be discouraging for patients who are seeking out help for their substance abuse addiction.
In our articles, we found a couple of similarities and a couple of differences between the authors' views. The first comparison that we found was between my article and Olivia's article, and both supported the view that parental drug use greatly affected the kids and their developmental skills. In my article, it gave instances like communication and fine motor skills that the kids were affected in, and in Olivia's, it was more like a physical thing that kids dealt with right as they were born.
In both Brianna's article and my article, the authors agreed that drug use will alter the way the user will act and think because it affects many parts of the brain.
on the other hand, or each drug has a different effect on the child. First, a mother who is addicted to prescription drugs such as opiates give the children effects such as skin discoloration. Secondly, a child that is born with an addiction to cocaine often have internal effects, which for example, this child was born with no abdomen muscles. Thirdly, a child that is born addicted to meth may have a cleft palate, and later on in life they have the possibility of surgery, but it's very expensive and they still live with the scars. Lastly, marijuana. A child that is born addicted to marijuana has less severe impacts, but they are often born with a low weight.
However, unlike Olivia's article, the author stated that drugs used did not matter. It was just testing substance use overall and not a specific drug.
Another contrast would be that in my article, the authors included plenty of diversity as far as age and race in the people that they used for their study.
However, the author in my article felt that the study was limited by the fact that there wasn't a big diversity of people. It was only testing males and African Americans.
One thing that I personally learned was that college students are more at risk for substance abuse because of the high stress environment that they are in and because of the risk-provoking environment they live in as well.
The second learning point that we focused on was the fact that parental drug use can greatly influence kids' developmental skills. I didn't realize that it developed such basic skills that kids develop, and it often affects them for the rest of their lives. Parental drug use can affect motor skills, problem solving, and communication.
Something that I learned from my article is that many mothers are in denial of their drug use, and therefore that directly impacts the birth of their child. So the drug abuse test is very efficient. And the children that are born with defects, each drug has a different effect on the child and how they will live the rest of their life.
Something that I learned from analyzing all these articles was that substance abuse mainly affects impulsive decisions just because of the negative effects that the drugs can have on the cognitive functions of your brain. After analyzing all of our articles and discussing them with each other, we all learned a lot of new quality information.